So basically what we're going to be doing here is we have to find out, is the nervous system sending the appropriate electrical signal to the muscles to be able to allow them to absorb force? If not, then consequently no type of therapy is going to work because the main power in the house is off.
Right.
So what we're doing now is we tested the lower body. The lower body was fine. Now we're testing the upper body. We're testing the shoulders. And this is a shoulder that bothers him, and you notice that he cannot resist at all. On this side, he's very strong. And people say, well, you're pushing harder. No, 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 no. It has nothing to do with strength. Strength, the more weight you lift doesn't make any difference here. This is the muscle firing correctly? It's kind of like a spark plug. If the spark plug is gapped incorrectly, it won't fire the gasoline. His spark plug is gapped incorrectly, and he believes that he has an upper shoulder problem, and we just told him he doesn't have an upper shoulder problem. He has a different problem, and that is the long head of the biceps tendon, it's slightly shifted, and it went out of the groove, and it shuts down all the electrical energy going directly to the shoulder. So now he's raising his arms, and that's just about as high as he can raise his arms. And they're about equal with his ear. And he's raising his arm not with the front of his shoulder, but with the back of his shoulder. And that's why that muscle consequently kept on getting tighter and tighter and tighter. And he says there's a knot back there. And he'll point all the time. It's always back here. It's always back here. And again, remember, wherever you feel pain is where the pain ended up, not where it's coming from. So what I'm doing is explaining to him right now that this is not a strength issue, this is a neurological issue which is causing these symptoms. And I'm talking to him now about the tendon, and that's a little tendon that runs, well, it's not a little tendon, it's a long tendon. It's called the long head of the biceps tendon, and it attaches right up here. So now it's kind of like a chain on a bicycle sprocket. If the chain is halfway off the bicycle sprocket, does the bike work? No. His chain is halfway off the bicycle sprocket, so his bike isn't going to work. We're going to put the chain back on the bicycle, and it's going to work in just a few seconds here. So what I'm doing is explaining to him that his anterior, posterior deltoids are completely turned off. There's nothing happening. And then I'm going to ask him to raise his arm as soon as I get done with this test. And now we're going to push down on the arm, and there's nothing there. That doesn't mean he's not strong. He could be the strongest guy in the world. It has nothing to do with strength. There's no electrical impulse going to the appropriate muscles to stabilize that joint. Now we're going to change that. So he's kind of baffled, and what I'm going to say to him is just relax, and I'm just going to go in and find out where that tendon is. And you don't have to be a chiropractor, you don't have to be a licensed medical practitioner to do that. And all I did is put the chain back on the bicycle sprocket, and now we see that he's strong again.
That is so amazing.
and it has nothing to do with strength. It's just that now the muscles are working. And he was kind of fascinated by that.
Yes, and I see that you're explaining it to him because it's amazing to him that he wasn't even aware that that was going on.
No, he had no idea. And this is probably, I say this is probably one of the most misunderstood injuries there is. When I said that Yakov Katz believed that the greater the stimulus, the greater the change.
Sure.
So if you can't raise your arm up here because it hurts, you're not going to raise your arm up any further than that.
Right.
Because your brain says stop. What I do is take the brain out of the equation and allow you to raise your arm straight up. Now how I do that is by sending a signal to the muscle to get out of this position and get into this position. And then I allow it and facilitate it to move. So as we did that, his 7 to 8 pain went down to a 1 or a 2.
Okay. And I believe we have the next clip in regards to him lifting his arm and showing a little bit of tingle in his finger.
Right. At this position, he hasn't been in that position for quite some time. So consequently, his muscles aren't used to being in that position. So if you're only used to being in this position, this is the only position you're going to be in.
In a fist, yes.
Okay? So we're now getting him used to being in this position. So consequently, he's going to feel a little tingle. And what we're doing right here is we're showing him that he's raising his arm with those muscles. So now what I'm going to do is go back in there and take his brain out of the equation, relax those muscles because they're like this, and then we'll see a difference in how he raises his arm.
Right.
Now we're doing a technique, and this is basically our protocol. We call this search and destroy, and he's pointing to where he believes the problem is. And so what we're doing now is we're relaxing those symptoms. And in the treatment that we'll do, we're going to get rid of the symptoms by getting rid of the origin of the symptoms rather than working on the symptoms. We're just doing this right here just simply so we can relax it and demonstrate to him that we can raise his arm probably 2 to 3 inches behind his head. And it hasn't been there for quite some time. So all we're doing now is sending a signal, neurological signal, to relax the muscle. So the muscle has got this signal, and I just changed the signal to go to here. And you saw how he didn't give us any facial evidence of discomfort when we were on his back, when we were on his shoulder. And now when we put it underneath that arm, where every indication to me was that that's where the problem is, then you will see very quickly a change in his facial appearance. Because that is where the problem is coming from, not where it ended up, which is going to be right underneath his armpit. And what we're looking for is, and I tell all the patients, and I told Ron at the time, think of me like an electrician. I'm looking for an electrical short.
Okay.
And so we're going to find the electrical short. So we've identified these spots by using our technique called search and destroy. We can basically map your body, and I can tell you any place in your entire life you've ever sustained trauma because it's still there. It's still walled off by scar tissue, and it's still there.